Thank you. So good afternoon. I'm Paul Fry, President and CEO of the Washington County Chamber of Commerce, and welcome to today's community discussion on cultural conversations for an equitable community. Food deserts, fast food and food pantries, how can we increase access to healthy food options? This is a series in a collaboration between the leadership of Washington County, the Greater Hagerstown Committee, and Washington County Chamber of Commerce. And the goal of each of these conversations is to shine a light on any cultural inequities that exist in our community and how our three organizations members can make an impact. First, by understanding the issues, and then second, by answering a call to action. This is the third part in a three-part series. Part one of the series, led by Dr. Tara Sargent in leadership of Washington County, was an inequitable virus, the impact that COVID-19 has had on our community. Last week, Jim Kercheval and the Greater Hagerstown Committee led part two of the series, Basic Needs During the Pandemic, Evictions, Shutoffs, and the Rental Market. And so today, again, we'll be talking about food deserts and how we can address these healthy food options. Just a couple of housekeeping items first. This discussion, like our previous discussions, is being recorded. All three discussions will be made available to view. It will be posted on our websites and our social media pages. So we can avoid background noises. It looks like all of you have done this already. Just please mute your microphone unless you're answering or asking questions. You can tap or type your questions into the chat box, and they'll be monitored, and we'll ask our panelists the questions as we move forward. And today's agenda, just so you know how we're going to move forward, I will briefly introduce each of our panelists. They will each take about 10 minutes to discuss the issues around the basic need of access to healthy food from their perspective. Next, we will entertain questions for our panelists. Again, please type your questions into the chat box, and Christina and Dawn will help us monitor them as we go along. Finally, we'll close with our panelists letting us know how we can do what we can do to address the issues with a call to action. So with that, let's go ahead and meet our panelists. First, we have Mr. Frank Ducey. Frank is the Regional Program Director for Maryland Food Bank, the Western Branch. Frank is responsible for leading anti-hunger programs and solutions in the Western region, which includes Frederick, Washington, Allegheny, and Garrett counties, working directly with more than 140 of Maryland Food Bank's distribution partners throughout the region. Frank has been with the Maryland Food Bank since 2014, relocating to the Hagerstown area from Elk Ridge, Maryland in 2017 to lead programmatic activities in Western Maryland. Frank graduated from West Virginia University with a BS in Public Relations and a minor in Sociology. Frank currently serves on the steering committee for the Hagerstown Area Religious Council, Micah's Backpack Program, and is a member of Hagerstown Rotary Club, and as a graduate of Leadership Washington County, class of 33. Jessica Scott moved to Hagerstown in 1994, working as a fraud rep credit analyst at Citicorp for 7 years. She has worked in the nonprofit sector for 20 years, including at the American Kidney Fund and at the Maryland Symphony Orchestra. Currently, Jessica works as a program director for Habitat for Humanity of Washington County. She is responsible for vetting and counseling families on becoming homeowners, as well as working as a liaison with the faith community and recruiting volunteers for all of the Habitat initiatives here in Washington County. A 2016 graduate of Leadership Washington County, she currently serves as the president of the board of directors of the Robert W. Johnson Community Center. As a mother of six children and a grandmother to 10 grandchildren, Jessica believes in the core values that a strong sense of community plays in the development of our future generations. Finally, we have Dr. David Shuster. David Shuster currently serves as the CEO of the Horizon Goodwill Industries in Hagerstown, Maryland. He has been with Horizon Goodwill since November 2013, serving previously as Associate Director of Environmental Services, Director of Operations and Compliance, and as the interim CEO. Goodwill's mission is to remove barriers and create equitable opportunities for individuals and communities to thrive through the power of sustained and meaningful employment. Hailing originally from Springfield, Virginia, David holds a Bachelor of Arts degree in Theater Arts and a Master of Science degree in Health and Physical Education from Virginia Tech. He earned his doctoral degree in Educational Leadership from Frostburg University, where his dissertation research specifically focused on the application of positive psychology theories and the ability of of faculty to influence student hope and success. David and his wife, Alina, have 4 children, and they reside in Smithsburg. So with that, again, we're going to kick this off with Dave Shuster. Dave, it's all yours, buddy.
All right. Good afternoon, folks. Welcome. Thank you for all joining us for the last of the Cultural Conversation series today. I want to start off just very quickly, answering what may be the obvious question in the room. What is Goodwill doing talking about food and food equity and food systems? And I will tell you, we got involved in looking at this area back in March of this year. Actually, we were approached by a number of organizations right about the launch of the bold health goal to lose 1 million community pounds, and the recognition that goal might be more challenging for some portions of the community than others by virtue of their access to reasonably priced healthy foods. We were brought into the conversation for 2 reasons. One, as you'd imagine, we're familiar with running retail enterprises through our donated goods thrift stores that we use to fund our mission. But the second piece is that, when we look at what are barriers to folks being able to maintain employment, there are many barriers, several of which have been the topic of some of the earlier conversations, including housing, but also food security can be considered a barrier to employment. It's challenging sometimes to focus on getting up and going to work the next day if you also don't necessarily know where your next meal is coming from. So there's a number of reasons, and when I get into a couple of comments and data points here, we'll also talk about this food and food security is actually an economic development initiative as well. But to get started today, I want to talk just briefly, what is a food desert? For those who may not be familiar absolutely with the term. It's typically used to describe an area in which residents don't have convenient access to a full service grocery market that offers fresh and healthy foods at reasonable prices. This is as opposed to prepared, processed, prepackaged, and convenience items. So a food desert doesn't necessarily mean that you don't have access to food sources or to calories, but what it does represent is that it's typically unhealthier foods, and there's a high population density of liquor stores, convenience stores, fast food restaurants. Again, they're selling highly processed foods that are high in sugar, oil, salt, artificial ingredients. The definition, food desert, is defined by the USDA. Generally, there's a couple of criteria, but 2 primary ones are that the residents in a particular area, and we usually use census block groups, of 20% or greater poverty rate, and then 1/3 or more of the residents in that area live more than a mile away from a supermarket. And in a minute, when we look at some mapping, you'll see that the definition can be a little bit variable depending also on geography and population density. But more on that in a minute. When you look at urban food deserts in particular, and relevant to our conversation today, you do find that they tend to be predominantly concentrated in areas of low income, areas where residents typically don't have cars, and in most urban food desert situations, they also are almost always communities of color. The data models that are used to define food deserts do include variables beyond just income and transportation. They do factor distance to stores, the types of stores, products that are in the area. So things like farmers markets can factor into the equation. What transportation is available, how long it might take to navigate that transportation. If you have public transportation, but it's 9 different bus routes and transfer stations to get from your home to the grocery store, that may not be as accessible as you think, even though public transportation technically would serve that area. Population density plays a factor. As mentioned earlier, household income is also in there. So there are multiple groups nationally that are studying food equity and food systems. One of them is a group named the Reinvestment Fund, who's done some substantial research into equitable food access and the food systems that support them. And so they use a slightly different term, which is what I'm gonna pivot to now, and they refer to it as a limited supermarket access area. The factors they use are based on the same ones that the USDA uses to define these areas. So Paul, if you could advance to the next slide for me, please. So you'll see on here, kind of outlined in orange, those of you who are familiar with our geography, hopefully everybody, Washington County is on here. We actually have, per the Reinvestment Fund, there are actually 3 limited supermarket access areas in Washington County. Probably anybody who's lived here for any length of time won't find this to be particularly surprising. The first is right in the middle of your screen. It's a fairly substantial purple area that's centered around the Clear Spring Big Pool area. Secondly, down at the bottom, you'll see there's a portion of South County that falls into a limited supermarket access area. And then very small area that we're going to zoom on in here in just a second, to the east would be downtown Hagerstown is the third one. As you can imagine, based on the factors I was just talking about, each of these has kind of earned or gotten the LSA designation for different reasons. In terms of the ones that are in the lower population density areas, that it's really a factor of distance out there, and then just again, as you might imagine, distance and availability of one or more grocery markets out there. So, Paul, if you'd go ahead and bring me to the next slide, please. So zooming in on the downtown Hagerstown area, just need to move my screen for a minute so I can see. All right. You will notice that the area outlined in blue is the limited supermarket access area of Hagerstown. So you'll see to the north of 40, it basically centers on the Jonathan Street corridor, and then it branches out south. And I suppose it's not surprising that a cemetery would be included as a limited supermarket access area, though I'm guessing the residents of the cemetery don't need access to a grocery store. But again, you can see that it highlights the downtown core. On this map, I have this one overlays to some of the data points the median household income within that area. And so in this case, the lighter the color, the lower the median household income. So you will also see that right now, although I will say this is based on 2018 data, and as we know from the census just having been reconducted in 2020, I would imagine we will get much more current and updated data. So some of this is based on estimates at this point that was originally built on 2010 census data, but fairly reliable. And you'll see again that this particular low supermarket access area overlays pretty significantly with one of the lowest median household income areas in downtown Hagerstown. So if you'll flip to the next one for me. So similarly, families in poverty. So in this one, the darkest green represents 17% or more families in poverty. And again, if you look at that blue outline, you'll see that a substantial portion of this area again falls into that category. Not to obviously say or dismiss the fact that this map branches out and there's this statistic expands further beyond just this particular block group and where the LSA is. But again, looking at a second measure of income here, and then the third and final one, if you don't mind, Paul. This one is looking at one particular piece of health data as it sort of relates to the importance of this topic. And again, this one is obesity rate. So the northern section of this area up in the Jonathan Street area reported it's about 33% of the population there, and then immediately to the south is one of the next highest groups. So again, you start to get a sense, to confirm that data model that lower income, possible lack of transportation, and you also then start to see what the impact on various health factors are, which is one of the reasons that this is a particularly important issue. So moving from those slides, just a couple of further analysis points. You typically find then that low-income communities disproportionately experience hunger, the lack of access to healthy food, and you then see, as the mapping suggests here, that they have greater health challenges as a result. Some of the reasons why this happens, as you might imagine, one of the issues is that these communities typically lack the economic power to maintain a full service traditional grocery retailer. And so instead what happens is fast food restaurants move in, corner convenience stores move in, they're selling prepackaged foods, less healthy options. And while there's, this is not to suggest that those businesses should not be allowed and encouraged to thrive in these areas. You have to have alternatives if you're really going to address this issue. What has ended up happening then is that fast food and convenience stores have grown pretty consistently in poor urban neighborhoods. But the supermarkets that have fresh, high quality food tend to push out and they move to the more spacious and affluent suburbs. So as you can imagine, there's a couple of driving factors to that. The economic reality of operating a for-profit business where you have to generate income to pay for your overhead and to pay for your employees is a concern. Space considerations in an urban area, it's hard to find 20, 30,000 square feet for a traditional grocery store model in a downtown location. And then some of the social factors that overlay these areas have all led to the divestment of supermarkets in low-income urban areas. So what you find then is that this migration of stores out of the area and the lack of transportation for folks to get out to the suburbs, and then you also find that convenience stores, as we probably all know, tend to charge slightly higher per item prices for even the products that they do sell than a supermarket does, because they're not buying in a bulk or large quantity. Again, you tend to see a default to fast food options as the dominant food source in many low-income urban communities. So that's kind of an overview of the scope of the problem, and particularly some of the information as it pertains to downtown Hagerstown. This is sort of the long-term problem that we're talking about today. I suspect Frank will be able to address here very shortly a little bit more of the shorter-term impacts of the economic crisis that the pandemic has created on access to food. But and when we come back to the call to action, we'll talk about this further. But the reality is, what you see here is both a challenge, but you also see an opportunity as we move forward, particularly to help folks who are on a path to economic sustainability have opportunities to begin to thrive and lead healthier lives. So with that, I will pause here and yield until it's time for questions.
Thank you, Dave. And we will move on now to Jessica Scott, again with Robert Johnson Community Center. Jessica, good afternoon. The floor is yours, and just make sure you unmute yourself. There you go. You're set.
Good afternoon, everyone. So it's interesting when I was first asked to be on this panel, my first thought was I don't have anything to do with any of this. This isn't my area of expertise, but perhaps I will be able to offer a different view. The Robert W. Johnson Community Center for years has been hosting a monthly food drop, giving away food to whoever comes up and needs it. And we are located directly in the Jonathan Street community. And so all of our neighbors fit that graph that Dr. Shuster just showed. So I mean, with the work that I do for Habitat as well, I'm in I directly work with these people, the people that fit these great graphs and that type of thing. So perhaps that's why I was asked to be on, because food equity and that type of thing is not my area. Pandemic and 2020 has offered us, given us access to virtual supermarkets and food delivery and that type of thing. But the neighbors that we work with, most of them use food stamps, and so they don't have access to those things. When you have a small amount of food stamps or income that you can use for food, then you need to make it stretch as far as you can. So $1 frozen meal, high in sodium, high in fat, can go a much longer time than buying meats and vegetables and that type of thing. I just think that we really do need to do some more education around it. The Maryland Food Bank, when he speaks, we are very grateful for the work that they've been doing and the amount of food that they've been bringing into the community that we've been able to give away. But a lot of times, some of these residents don't even know what to do with some of those vegetables. They've never experienced or had those vegetables before, and so we need to probably try to educate a little bit better. Most times when we get our boxes, we don't even know what's going to be in the boxes that we're going to distribute, and so what we've been trying to do now is when we get the boxes, there might normally be an hour or two before we move in to giving those boxes away. We're trying to identify recipes and different things that we can share with the residents in the community when they pick up the boxes, to try to offer them some, some education on the food that are in the boxes, what they can do differently, how they can store it, how you maintain that food, and how long it'll last. So there's quite a bit. Dr. Shuster shared almost a lot of what I was going to talk about, the numbers, the area, that type of thing. So I won't go back over that. I do want to introduce, maybe we're talking about food deserts. Just another word or description is food swamps. So food swamps are where there's a lot of fast food. And if you think of a swamp and the muddy end, it's high in fat, it's high in calories, and it's extremely cheap. And so we have quite a bit of that available within the perimeter of those areas that Dr. Schuster highlighted for us. If you can get a $5 pizza to feed your family, then you're going to do that instead of going to the grocery store and buying fruits and vegetables, because that'll feed them a lot better, a lot easier. So he discussed obesity and those type of things. So those are all concerns that we have in the community, but there is a great need, and there are people who are coming for the fresh food and fresh fruit and vegetables. They are picking that stuff up, and they are trying to utilize them in the best way that they can, especially because that food is available and it's free for them. So I'll stop and wait for any additional questions, because I can offer and explain a lot of what the direct impact that these families are having by not having healthier food. And I mean, you can go down a rabbit hole on the reasons that low income affects, the effects that it has, not just on this, but on everything. So because of housing and that type of thing, I won't go there. I'll stop and wait for questions as well.
Thank you, Jessica. And be thinking about some call to action that we can address some of these issues that you brought up, and we'll come back to you with some questions. And with that, we're going to go to Frank. And Frank, I think you have screen sharing abilities. I think you wanted to share some of your information. So the floor is yours, and welcome.
Thank you, Paul, and good afternoon, everyone. My name is Frank Ducey, and I'm with the Maryland Food Bank Western Branch, Regional Programs Director for Western Maryland, as Paul said. So what I'm going to do today is just give you some high-level statistics on what's going on in Washington County and Maryland, and then show you some neat tools that we use and make available to the public, where you can see sort of, our programmatic activity as the Maryland Food Bank, where food's going, and some possible locations where there might be some disparities in food access, or just a high level of need that needs to be addressed, as a collective. So COVID-19 has definitely pushed us and really stretched us to our maximum in terms of being able to source food. It's put a tremendous strain on our supply chain, so we've just been trying to keep up. Just to put that into some numbers for you, statewide, since COVID-19 began in March, we've distributed a tremendous amount of food. So we more than 6.1 million pounds in October 2020 versus 2.8 million pounds in October 2019. So year over year, that's a 116% increase statewide. And, that definitely trickles down to Washington County, where we've been very active. We have currently 43 active unique distribution sites. And of those 43, we have 20 Pantry on the Go sites. So Pantry on the Go is a program that sort of ties into what we're talking about here, because it's programming that's designed specifically to bring food assistance to food deserts and other high need areas. It's a crucial program, one that Robert W. Johnson, Jessica Scott, they participate in. And it's a way for us to get healthier foods, namely produce, into the community. So this distribution model allows us to distribute large quantities of produce that would otherwise spoil very quickly, as well as other high quality nutritious foods as they're available. Kind of simplifies the process. We're able to do the delivery of these, multiple pallets of produce and other goods. We have our equipment that we can use to bring it directly to the partner site, so they're not having to, rent equipment or buy equipment to move product around. And then our target with that is just improving access to food, because we find that, transportation is of course a barrier. And, while there are many food pantries in the area that are stationary, there are also some areas that are underserved by those services. So, and then, there's some folks, some citizens that are, they don't have a vehicle or reliable transportation. They might be on foot. So trying to strategically deploy this Pantry on the Go programming is crucial as we try to meet the need in Washington County. So, we're definitely, like I said, during COVID-19, we've definitely been, tested in terms of our response. But as we go into 2021, what are our big focus areas is going to be expanding food access to those struggling most under COVID-19. So that would mean newly unemployed, communities of color, homebound, self-quarantine or quarantine populations. And Jessica's point, we want to increase nutrition education in any way that we can. So that might look like including educational inserts and recipes into deliveries that we're making of produce, because I think it's, not everyone knows what to do with produce, but there's so many things you can do. And it's something that, we feel so strongly about, and that we're, trying to really just pump as much as we can into the community to ensure folks are eating healthy. And then also, what's really been a point of emphasis for us in the last year or two, especially, is trying to use data to determine areas where, we need to deploy food distribution programs. So, the Pantry on the Go program is one that's, like I said, it's minimal barriers, it's easy to deploy. We can show up with our truck equipment, get the food there, and, we're able to distribute it and target those areas. But, also our other programs, many of the food pantries, soup kitchens, shelters in the area have programs with Maryland Food Bank. They're able to stock their pantries and their programs as often as they need. We have a 24/7 menu that they have access to called Agency Express. And then we also have the school pantry program. So we're in about 10 schools right now in Washington County doing the same types of food distributions and food programming. So with that and the data point, I'm going to share my screen. Fingers crossed this works. Okay. Can you see it's a map of Washington County? How do I look?
Yes, you got it.
Excellent. So this is the Maryland Hunger Map. It's available on our website, mdfoodbank.org. I'll show you that. So you go on our main page, this tab here, Hunger in Maryland, and click on Maryland Hunger Map. We don't need to wait for that to load, but when you open it up, it gives you access to the entire state. And you can see, if I zoom out here, where you have all this programming, because as an organization, we have our branch here in Hagerstown, and we also have our central office in Baltimore County, and then a branch on the Eastern Shores. We're serving the entire state with the exception of Montgomery and Prince George's County, which are served by the Capital Area Food Bank. But here, if we zoom in, the circles, the larger the circle represents a higher percentage of the population that is below the ALICE, which is United Way's measure of a realistic household survival budget, and the federally defined poverty level. So that larger circle means that, we have a higher percentage of folks that are in need. So click on those circles, gives you some more information on population, some statistics. I believe this was updated in 2018. So, it's definitely going to require updating once we have a full breadth of statistics in our arsenal. But what's neat about this is you can overlay this with our partner distribution points to see where we have various programs. So click on each of those points and you can see where we have partners. The colors denote various types of programming. So these red dots are the Pantry on the Go programs that I was explaining earlier. So New Hope Praise Ministries. So it kind of shows you where we have the highest concentration of Maryland Food Bank programs in the area. And conversely, there's other data sets that we can put into place and add layers to. So hunger hotspots are points that we've identified as, we definitely could stand to do better. So it's trying to quantify what that need is. We came up with a number based on, again, that the ALICE data as well as the federal poverty level data, combining that into one set, taking into account how many pounds of food are going in the community, and then trying to come up with a determination of what the unmet need is by pound. So you can see here in Hagerstown proper, the amount of food that we've distributed in that period versus what we could stand to distribute, what needs to be done going forward. So again, we could definitely update this, but this is the most recent data that we have and really interesting to overlay it. You can go on here and sort of play around with it, and you can really see where all the distribution points are. And it really, as we become more data focused and having that sort of guide our decisions on where to deploy programming, having information like this, it will be crucial. We're already, referring to it more than ever, because we try to get a combination of things, obviously the data, and then qualitative feedback that we're getting from our partners, who are the boots on the ground, telling us where the need is, from what they know. And perhaps there's an event happening that, data sets aren't necessarily going to show. Using an example, in Allegheny County, there was a paper mill in Luke that closed down, and the economic downturn was pretty tremendous. I think it was around 2,000 jobs across the paper mill and the associated industries that were lost. So we just kind of immediately had to deploy Pantry on the Go programming to help the population there kind of get through that crisis that they were facing. So there are, certain situations like that you always can account for, but do the best you can, and, taking all the data into account to make those decisions. And on this note of mapping, one other data set that we're playing around with, but it's not quite ready for showtime yet, is looking at the food insecurity rates in various census blocks, and then also seeing there, where there's a high level of food insecurity, especially in communities of color. So just using Washington County as a whole as a baseline, it's about 82% Caucasian and 12.5% African American, 5.8% Hispanic. So looking at some of these red areas here, which denotes a high level of food insecurity, and just popping these open, you can sort of see where there's higher levels of, Hispanic and African American population. So here it's 29%. Here's another red area. That's 11%. Like, the data isn't fully fleshed out, but something that we're starting to kind of sink our teeth into to figure out, where there's disparities and, what we could be doing in terms of programming and working with potential partners in the area to address the needs. So interesting to look at. You can see Hagerstown, certainly, here's an area that's almost half African American that has a high level of food insecurity. So, and this you can also overlay with our network of partners just to kind of see where we're getting food distribution resources to. So this isn't, like I said, quite ready for the presses yet, but something we're going to be looking at going forward, especially as we get into 2021, as it's going to be one of our primary focuses as we start the new year, specifically, like I said, expanding food access to communities of color, and those newly unemployed folks that are affected by COVID-19. So with that, I will stop and see if there's any immediate questions about any of this.
Great, thanks, Frank. And if you stop your screen share, then I'll just bring up here one real quick. We'll just get back to this. And so I think the three of you, Dave talked about some of the indicators for some of the issues we're dealing with. Low income, no vehicles of transportation, impacts more communities of color. And there's a lack of an economic ability to open a supermarket. So then some other places move in. And then Jessica talked about some of the programs out there with monthly food drops, and the fact that some people can get virtual food deliveries, but with food stamps, that hinders the process. And Frank and Jessica talked about there's fresh vegetables available, but how do you prepare them and what's the education there? And then Frank showed us a couple good data tools that we can use to indicate, number one, where the issues are, and more importantly, where are the resources. And so with that, we'll open this up for questions. And again, put your questions in the chat box, or you can, if that's not working, we can verbally ask a question, but I'll have Christine, if you'll manage this chat box with the questions.
Sure. We have one in there from Stacy Michael that says, have we been able to increase the amount of food drives to help close that gap more?
So I'll answer. I'll answer first. So we have had probably double the amount of food drives that we normally have. But the interesting part is those larger organizations are reaching out to people outside of the community. And so the food isn't, unless those of us in the community know about it, we're not getting the food, so the food is on the outskirts. And we're needing to ask to be included in that instead of being at the table more, to be able to distribute the food. So I'm participating, for instance, with Gateway. And so I need to be at Gateway at 6 o'clock in the morning to pick up food and then bring it back into the community. So we have increased the amount of food that is coming in. There's still lines and lines of people. So I believe that it is serving a good. I don't know how much of a gap it's closing.
Dave, you or Frank, do either you or Frank want to weigh in on this question?
Sure. So we have definitely received a tremendous amount of support during the pandemic, but our need remains high in trying to keep up with the increased demand. So it's essentially we're doubling the output of food that we were doing year over year. So we're going to need that much more support. The vast majority of our resources go directly into our programming. It's about 93% of all funding we receive. So we're, really committed to keeping our partners operating efficiently, because without them, we can't try to end hunger in Maryland, quite simply. So, and we really rely on generous donations to make that happen. So, especially recently, we've been relying on some virtual food drives, which have seemed to have the greatest impact. And, especially as, demand increases and COVID-19 cases grow, but we still need additional funds to continue to buy and distribute food in local communities. So it's going to take a long time for the economy to absorb the job losses we've seen, and we expect this heightened state of demand to continue for an extended period of time, even after the pandemic is behind us. But, certainly lots of ways that folks can get involved, traditional food drives. If you want more information on the virtual food drives, I can connect everyone with that as well. But definitely ways that we can, continue to support the community.
Dave or Christina, next question, if Dave doesn't have any other additional feedback or comments.
We don't have any questions in the chat. If anyone who wants to unmute, you're welcome to ask a question, or we can go to some of our backup questions for the group.
I saw, I did hear from Jeff Prue, who's the operations director for WCPS, and he talked with me, and you may have read about some of the meals for students, especially with school not being in session and the impact of COVID. And they thought they'd get, 1,000 or 1,500 meal requests. They actually had over 3,000 requests. They had to stop taking requests for a bit to cover that. So, I don't know if anyone's interaction with the school kids, our three panelists or anyone in the audience, what the thoughts are, the impact of schools not being in session and what that does for the meal availability for the students.
The community center has a WCPS truck in a parking lot. So children can come to the parking lot who don't attend the center for virtual learning during the day. They can come, anyone 18 and under can come and get food. And what the school has generously done is create a bag that they can then take home and eat at a later time. So, there's a huge need, and they are filling that need. But there's so many neighborhoods that I don't think have access to it. We are grateful that we have it there at the community center. But a lot of times we're still providing snacks to the students that come to the center or people who walk up. We've limited, of course, because of COVID, anyone who can come to the center. But there's still a need. The seniors that are in the community don't have access to the food because they're over 18. So we're trying to feed them as well. The community center is one of the smallest, lowest donated organizations, and we're trying to do it every 2 weeks. So it's a huge burden.
We have two new questions. The first is, what is the status of the nonprofit grocery store?
Well, that was going to be part of my call to action, in fact, at the end. So I can certainly go into that now if you'd like me to.
Sure.
All right. So when you start looking at solutions to this issue, and we, particularly at Goodwill, we tend to look at the full spectrum pathway of solutions. So getting folks from a crisis standpoint to a stable standpoint, and then on to a place where they're then able to thrive, right? And so, I appreciate that today we've got sort of a perspective of that entire continuum here in the cast today. Certainly, food pantries are absolutely essential in a crisis response. But then when you move on to the folks that, have income and have the opportunity to purchase food, perhaps still, as Jessica mentioned, critically, through SNAP and EBT vendor programs, on their way to stabilizing and then hopefully on the way to thriving. What do you do if you still don't have a food market that's accessible to you, right? And so that is where I think the nonprofit grocery model comes in, because what ends up happening when for-profit retailers leave is that oftentimes until they have enough economic indicators in an area that suggests that it would be worth their while to re-enter that market, they're not coming back. So what do you do? And in multiple communities now, there are models where nonprofit collaborations exist to bring food resources back into communities, and in many senses, by pulling together both diverse funding streams that might be accessible to nonprofit organizations as opposed to for-profit businesses, a wide array of community partners to do things like Jessica was talking about, address educational and health components that might go around access to healthy food, and then as an economic and business model. And so we are in fact looking at that, and it's a collaborative effort. This is, if in the grand scheme of things, this is not a government problem solely. This is not the responsibility of food banks and nonprofits. It's not businesses. This is everybody who has to work together to solve this. you know, a prime example I can give you is if you look right now at the wealth of agricultural producers that we have in Washington County and access to those products, among other things. You know, as an example, you know, I'm fortunate enough to live out in Smithsburg. I can access with a vehicle any number of agricultural farm stands out here, and they sell many times their seconds fruits, which are, you know, as we know, slightly imperfect, blemished, for pennies on the dollar compared to what first farm produce might cost. So the question you would then ask is, if you're going to reinvent the food system, how do you get that stuff from out here into downtown, where those folks may be able to get better access to that, to purchase it through whatever means, so that it actually gets to folks that don't have the means to get out because of transportation to it. That's just one example of how you can rethink the food system globally in a community to try to do that. The other thing I think we need to remember here is that while there is certainly a need to address this from an equity standpoint in the downtown community, it is also a food market that offers reasonably priced, healthy food is an economic and community development anchor in most places. You know, they employ people, they attract other businesses, typically they increase surrounding property values, and it improves livability. One would argue that if you're looking for a place to live, one of the first things you probably consider is there food available, and how far do I have to go to get it? So it is also, again, I think, incumbent upon the community as a whole to look at opportunities to reinvest in that core and figure out how to bring this together. So we are working diligently on that. We've got a number of partners that we've been working with since earlier in this year to fully build out a model to engage with folks in the local community. We've spoken with Jessica several times about this as well, and others, Terrence Moore and Reggie Turner. You know, we've been working with Jordy at the CAC. We've spoken with some of the community health representatives at Emeritus as it ties into bold health goals and what resources they might have as their physicians see the need to prescribe healthy foods to help folks manage their health issues. So there's a huge spectrum of opportunity that exists here, I think. So that would be my call to action is, you know, as we all need to work together, identify any more voices that might need to be at the table, as Jessica lifted up earlier, to sort of bring a project like this to reality, because I think there's multiple benefits for a broad spectrum of the community if we're able to do it.
I'm going to piggyback on that with a question that, you know, now Dave has mentioned, and Jess, that we need to do a better job of making sure the right voices are at the table to get the food to those most in need. How can the community help do that?
This is any of the panelists. Dave, I see you're up, but Dave or Jessica or Frank?
I can give you a high level thought. I would actually be interested also in Jessica's thoughts specifically as she interacts with folks on a daily basis, you know, at a more personal level. One of the things that we've learned, particularly in the pandemic, in terms of accessing any of our support programs that we do at Goodwill, is that virtual is challenging for a significant portion of the community, either due to lack of internet access, in terms of just connectivity, lack of the technology required to access the internet, lack of digital skills to access internet, a combination of factors. And so, you know, while it's great to be able to move programming virtually, I think that oftentimes when we communicate primarily electronically, and that's what we've had to do, especially now, there are gaps that come up there in terms of communication. I don't know if Jessica can reinforce or shed some additional light on that, but I suspect that's part of it. At least currently.
It is definitely part of it. We have 40 students in the community center because they don't necessarily have internet access at home. And so we're trying to support them. They have to be in class early, so we're trying to give breakfast and lunch and a snack in the afternoon. It is extremely challenging. The community center, when we started going virtual, we had to ask for additional internet because we knew we couldn't support all of the children that would be in the center. And we, you know, unbeknownst to us, we had a internet that wasn't even offered anymore. We don't have broadband, and so that's something that we need to focus on. I mean, because going forward, I mean, 2021 is going to be totally different. I don't know how children will finish the school year, but if the community center and Boys and Girls Club and other organizations like us need to continue to host virtual learnings, then that internet access becomes even more important.
Couple of other thoughts coming in the chat here. So here are two thoughts along the same line is how can we help deliver, how can a food drive help deliver, partner with farmers to deliver more healthy choices? And another thought was, as more demolished and vacant lots are created, could we create community gardens to educate the community on agriculture and healthy foods? Just some other thoughts there.
That's interesting with the community garden. I know Scott Nicewarner was on the call. I don't know if he still is, but that's an interesting concept. I know we have one down toward Bester, I think, towards the Bester community, but that's an interesting thought. Scott, if you're still on, any thoughts on that?
Well, we talked about that with Dave and some others later last week, and certainly something that that we're going to keep in mind once we get into the new year.
Thank you. And also, Christina, I saw a comment from the library just quickly that they're a resource. I didn't quite read all of it. So if someone's on from the library, if you can comment.
Sure, I can speak for Anne. Shared that the library has an abundant resources and staff to assist with topics of food, nutrition, health, and wellness. They even have a portable kitchen and look forward to hosting cooking classes for the community post-pandemic. Mary Ellen Waltmeyer also shared that the University of Maryland Extension is a great resource for education regarding nutrition, food safety, and wellness in the community.
I also wanted to note Healthy Washington County is an initiative. We have a number of partners, including some of the big food vendors, Barilla, Pasta, and some of the yogurt folks. And I saw Dr. Joshi was on the call initially, but I know that the hospital has some initiatives. And Dr. Joshi, don't know if you have any comments or feedback.
I don't think he's still on with us, but there is, healthywashingtoncounty.org, I believe is the website that you can check out.
Christine, any burning questions? We're getting ready to wrap up. I wanted to hear from each of the panelists for like 60 seconds. We're going to start in reverse order with Frank, and then we'll go to Jessica, and then we'll end with Dave. You have about 60 seconds. Any call to action, anything else we didn't talk about you think is important?
Thank you, Paul. So I think it's a lot has been said already, but really interesting discussion, and really thrilled to be a part of it. I definitely, if there's anything going on in terms of, new initiatives, like I heard the nonprofit grocery store, I definitely want to know how Maryland Food Bank can play a part in that, especially with regard to sourcing of food. We may be able to assist in some way. So definitely would be exciting to be a part of those conversations. And I guess, why is it important for you to support Maryland Food Bank right now? It's, again, we're committed to keeping our partners operating efficiently, and we rely on donations to make that happen. So we've received a tremendous amount of support, but that need for financial support remains high. So please try to get involved, whether it be through virtual food drives or traditional food drives, or just assisting, the mom and pop food pantries, helping out at Pantry on the Go events, food distributions that you know of, or just kind of being a part of the solution to, improving access for individuals. So, certainly lots of cases of folks that are homebound now more than ever. So I think home deliveries are going to be definitely something that's going to see a massive increase in the frequency. So just, make yourself available and, do your best to help out, because it's going to take a long time for the economy to absorb the losses we've seen. So I think we're just in the beginning, and we'll see a heightened state of demand to continue for a very long time. So, even after the pandemic's behind us, we're still going to be trudging along pretty tough to, do the best we can to help eradicate hunger in our community. So, but I do encourage everyone to reach out to me directly if you have any questions. You should have my contact information, and would be excited to collaborate on any level with you on any community initiatives. Thank you.
Frank, we appreciate it. Jessica, 60 seconds or so, call to action, any last minute comments you have before we wrap up.
I highlight exactly what he's saying. I mean, there are several organizations. We every time we do a food drop at the Robert W. Johnson Community Center, I think we deliver to about 20 families. We really don't highlight it that much because I don't want to be overwhelmed, but I know that there's a lot of communities that don't get food at all. So I would definitely encourage people to do exactly as he said, and reach out to organizations, the Community Commission or Washington County Commission on Aging, those food programs that help seniors get food, because that I'm concerned about children, of course, but I'm also concerned greatly about the seniors being fed and making sure on Wheels has enough volunteers, because serving on those commissions, I know that there aren't. So if people have a little bit of time and can donate, then please do that. Support organizations like the community center. When I put out a call for volunteers, please just show up and help. It's usually just a couple of hours. I'd love for the food store to stay in the community, close to the community, so that people can walk. We have people walking with all type of ailments to pick up boxes. And so it would be very nice if we could keep that very close so that people can get there easily.
Thank you, Jessica. And Dave, 60 seconds or so as you load up your vegetable wagon to bring it to Hagerstown.
Well, quite honestly, I appreciate that. I feel as though I spent way more than 60 seconds sort of addressing this earlier, but I'll highlight a story from another community that shows just how bold and incredible a vision for something like this for a long-term solution can be. In the Treme neighborhood of New Orleans, there is a public-private partnership that is heavy nonprofit led, that has a food market. It has a teaching kitchen that also doubles as a restaurant that serves meals at a discount. It has outdoor garden plots, as Terrence suggested and raised the question about earlier, and it has some community rooms in there. And so it bundles many of the facets that we've talked about today. You've got a reasonably priced healthy foods vendor with SNAP EBT accessibility. You have a kitchen where folks can learn how to prepare this food. You have an actual prepared meals food source for the community that's using healthy ingredients for the community. Those folks that want to get involved in how do we grow our own healthy food can have an opportunity to do that. And so, depending on how bold and how broad you want to go with this, there are lots of really innovative solutions to bring these resources back into portions of communities that have been long underserved and neglected from a food access standpoint.
Thank you, Dave. And certainly we want to thank all of our panelists here as we talk about food deserts, how to address the issues with healthy food options. I do want to thank our panelists again for the work you're doing in our community to address these issues. Dave, Frank, and Jessica. We will include all the contact information with this recording when we send it out. I want to thank Tara Sargent and Christina Williams, Leadership Washington County, Jim Kirchhoff, Dawn Miller with the Greater Hagerstown Committee for their work with us, and also Terrence Moore of TM Consulting for his work in organizing our conversations. As a reminder, all three of these discussions will be available for future viewing. Watch for upcoming cultural conversations for an equitable community after the first of the year. And then please let us know if you have any ideas for topics for future conversations. And I do want to again, our contact information will include here as we move forward. And with that, we thank you for your participation, for being on the call today, and then have a great holiday season and a happy new year. We'll look forward to talking to everyone soon. Thank you.